I'm Stephanie. I'm going to be your nurse today. Can you tell me, you are Jane Doe,
I am.
and can you tell me what you're having done today?
I'm having a tummy tuck.
Okay. I'm going to go over all the discharge instructions now while you're awake, because afterwards you're going to be sedated and you're not going to have that cognitive understanding. Okay, first I want to ask you, did you get all your prescriptions filled?
I did.
Okay. This is what you got filled?
Yes, it is. There's 1, 2, 3, and a pain medicine.
Okay. Prescriptions filled?
I have my pain medicine.
Okay. By chance, did you give this to the pharmacist?
No, I didn't know that was a prescription.
Okay. At your pre-op visit, you were given this paper and this, which looks like a prescription, to give to the pharmacist. This is actually a prescription. It has 3 medicines on it, and we can call your pharmacist when we're done.
Okay.
And just tell them to fill it. Do you still have you obviously still have this paper. Okay, so we'll get that and have your ride take it to the pharmacy. Okay, so I'm going to be very honest with you. After surgery, your best position is what you are in right now, a sitting position. All your pain is going to be between your breast and your belly button. You are going to be cut from hip to hip, but all your pain will be between this area.
So it's different than a C-section?
Yes, it's very different than a C-section. That being said, if you lean back, it's going to hurt a lot. So we encourage people to sit up straight or slightly lean forward. Getting up and out of a chair, you can do yourself, but you want to focus on your legs and your arms to do most of the work. So you're going to be like doing a good squat to sit down. If you do it that way, you won't have as much pain as you would if you didn't when you're in your abdominal area.
Okay.
After surgery, you can eat and drink whatever you would like. No alcohol as long as you're taking your medications. We recommend that you start off with something light and small and progress as the day goes on. Sometimes after surgery, anesthesia can make you nauseous. So soup, crackers, toast, that kind of thing, and then just advance. The one thing you have to do is drink plenty of fluids. Okay? You have to keep hydrated. If you're not urinating at least every 3 hours, you are not drinking enough. The inside of your mouth should be moist. Okay? A lot of people after this surgery come back in the next day, because you do have to come back in the next day for your first post-operative visit. They come in dehydrated because they're not drinking enough. You will have a binder on your stomach, and this is what it's going to look like. It's a big elastic Velcro binder, and it's going to go around you like this, okay? Everything stays on as is until you come back for your appointment tomorrow. When you come back in for your appointment tomorrow, the doctor will take that off. He'll look at everything, make sure everything is what it should be, put it back on, and then you can go home and take a shower, your first shower. When you take your first shower, make sure you have something cold to drink and somebody is in the bathroom with you, because the first time you take everything off, you could become faint, and if that should happen, just have your person escort you to the lid of the toilet, sit down, drink something cold, you should be fine. Okay. All right. Ice packs. We will give you a reusable ice pack. Open the clamp. Fill it up with your own ice. Make sure it's flat and the clamp is secure. You want to hear that click, okay? Or else you will be a wet mess. So you can lay it right on top of clothing. Never put ice directly on your skin. It could burn you, okay? So you always want, this has a cloth protective out coating. So therefore it won't burn you. So you can just lay it right on top of your binder and everything. And you can leave it on longer than the indicated 15 to 20 minutes because you have a couple barriers that it's going through. Okay? Your TED stockings, we're going to put these on you before surgery. These prevent blood clots. They're like white knee highs. So you can put these on. Your toes just come through the edge, and this comes up to your knee.
Should I do that now?
Yes. These will remain on. You can take them off to wash them in the washing machine, but they will remain on up to a week after surgery until you're really up and moving about, okay? We don't want you to lay around like a vegetable, okay? I want you to get up. I want you to walk around. Remember, you should be drinking so much that you have to go to the bathroom every 3 hours. When you're up and about, you can just walk the perimeter of your house and then sit back down. When you remember and you're sitting there in your chair, you can flex and extend your foot as you're sitting there. And this will also have your blood move in your calves, because that's where a lot of clots form, and we don't want that to happen to you. So well hydration and ambulation will decrease your risk of a DVT. Okay. All right, so you're going to have a drain. And I'm going to go over the drain. This drain looks like a hand grenade. Okay. This drain you will have up to 2 weeks after surgery. This will be located in your low abdomen, high pubic area, okay? Today, it's going to look real bright red blood, and it's going to be a decent amount, meaning that every time you get up and go to the bathroom, you may have to empty it. Every day, it's going to get less in the amount and lighter in color. It will turn a brown color, eventually a straw color, and eventually no fluid production. When it is not producing any fluid for a couple days, that's when the doctor will take it out.
Do I have to measure that?
No, you do not have to measure it. To open it, to empty it rather, you open up the lid, squeeze it out into a throwaway cup or directly into the toilet, squeeze all the air out of it as much as you can, and reapply the lid. This creates a vacuum, okay? This is what it should look like, a sucked-in hand grenade.
Can I wash it?
No. If you wash it or stick anything into it, you may see a blood clot hanging down inside. You don't go after it with tweezers. If you do, it can lead to infection, okay? So it's going to be ugly. You hide it under clothes.
Okay.
Now, the purpose of this drain is, do you ever see a blister fill up with fluid?
Mm-hmm.
Okay. So what that happens inside, when that encapsulated ball of fluid happens inside, we call it a seroma, okay? We don't want the seroma to happen at all. So the body produces fluid to heal itself. That's why it's so important to compress that area with that binder. Even after this drain is pulled, you will wear that binder, okay? Because you don't want that to have any chance of a seroma developing inside. So the binder compresses the area. As your body's healing, it's producing the fluid. This is designed to create a vacuum because gravity pulls down the fluid, and this will suck it out. Okay? So as it fills up, you will see how the sides become inflated. You can, at that time, empty it. Okay, so lid off, squeeze out, squeeze all the air out, reapply the lid.
Okay.
All right,
Mm-hmm.
This will be safety pinned onto your clothes. Can you take a shower with it? Yes, you can take a shower with it. Wash the area with soap and water. Do not wash the drain, and pat dry. Okay?
Okay.
Put your binder back on and put your safety pin it right back onto your binder. Okay, so this is a little exercise machine for your lungs. Anytime anybody has any abdominal or chest surgery, they don't want to take a deep breath. When they don't take a deep breath, pneumonia can develop. You're going to be inactive, not as active as you normally would be. When you are inactive, oxygen doesn't get down into your lower lobes of your lungs. Pneumonia can develop. That's why the elderly are prone to pneumonia, because they are more inactive than what they used to be. So, this machine, you have two chambers. You have the big chamber and the smaller chamber. I really don't care about the big chamber because this little chamber focuses on, it will tell you if you're doing it properly or improperly, okay? So you're before surgery, so I expect you to get up at least to 2,000. What you're going to do is you're going to wrap your mouth around the mouthpiece and you're going to take a slow, deep breath in, like you're sucking on a straw, okay? A thick milkshake, all right? As you are sucking on the straw, you want to maintain this ball in between the two arrows, okay? So put your mouth around that. Keep going, keep going, keep going, keep going, keep going, keep going, keep going. And let the bellow go all the way down. That was perfect. It's harder than it looks. It's harder than it looks. People go, oh, I can do this.
No, it's hard.
If you blow into it, nothing happens. Then you know you're doing it wrong. It's only if you're sucking in like a straw. Okay, so suck up again. Perfect. Now after surgery, don't be surprised if you don't get past 1,000. Okay. Is it going to hurt? Yes, it's going to hurt. Is the surgery going to hurt? Yes, it's going to hurt. Okay. I'm not going to sugarcoat this. It is painful. You will be given 2 different kinds of pain medicine. One is a usually Percocet, and the other one is Valium. Valium is your muscle relaxer. Percocet will help you with the pain. Okay. A lot of times people after the surgery have spasms in their stomach, so Valium they find more beneficial than the actual Percocet. The medicine, you could still take Percocet, you're still going to be in pain, okay? It is not like a headache where you take 2 Tylenol or 2 Advil and the pain goes away. That's not how it was designed. This is designed so it helps alleviate most of your pain, okay? Enough that you can still function and still get up and still do things. And as the body's healing, that's when your pain is going to become less and less every single day. Okay? Okay. We will give you these sheets. They're large. We will give you these enough to put on your chair, your sofa, the car ride home. You're going to be putting this there because you don't want to ruin the fabrics if you're wherever you're going to be sitting. Okay, the white side goes up. All right, and that will protect your seats. When you first come out of surgery, you will already have on a body garment. The body garment is a compression garment that the nurses will put on you. You won't remember it, okay? It is like black overalls, black tight overalls. It goes down to your, right below your calf, over your shoulders, and it has a hole in the private area so you can go to the bathroom without removing it, okay? So this is what it's going to look like, okay? As you can see, it looks like overalls. It will be very tight on you, okay? And here is the hole so you can go to the bathroom without removing it. You are having also your arms done. So we will be wrapping your arms in your upper forearm from here to your elbow in an ACE wrap. Okay, just like a regular ACE bandage. You will be draining. Liposuction, you drain. Okay? So you will be draining from right here your elbow on both sides. Okay. You will be draining, since you're having lipo of your inner thighs and your abdomen and the sides of your abdomen. You will have little holes that we leave open. Okay, they're less than a ½ inch big, and they'll be in both groins and possibly one in your belly button area, and sometimes one under each breast. Okay, they're open. You will be draining. It looks like watered down blood, okay? We will be giving you sheets that you can spread out. This is an example of the sheets. Okay, these open very large. You want to put these in your car, your bed, any chairs that you're going to be sitting on at home, because you will drain through. Okay, that's why we tell you to wear junky clothing that you don't care about to come. Easy clothing, comfortable clothing, loose fitting clothing. Okay, pajamas is a good thing to wear. All right, because it's going to come through. Our gauze that we will put gauze over the holes, okay, to catch any fluid. But if our gauze doesn't have a plastic coating, okay, to protect your clothing. So when they become saturated, you can reach in the hole of your private area, pull them out, and in its place you can slip a maxi pad. The maxi pads work very nicely. Get cheap maxi pads. They work very nicely because they absorb a lot, and they have the plastic coating on the outside to protect your clothing. Okay. Swelling, you're going to swell. Your hands are going to swell. Your feet are going to swell. Your privates are going to swell. Okay. It's all normal. All right. Between the compression garment, and you have to drink a lot of fluids afterwards. Okay. We're taking a lot off. You have to replenish yourself. Okay. So therefore, you should be drinking so much that you have to go to the bathroom, urinate at least every 3 hours. If you're not urinating every 3 hours, then you're not drinking enough, okay? And also, you want to get up and walk around. Don't be a vegetable and lay down because you had surgery. No excuse. You have to get up and walk around. You have these white stockings on your legs, and they go up to your knees. They help prevent blood clots, okay? When you're sitting down, you can flex and extend your feet to keep the blood circulating in the calf area, okay? So to getting up, walking around, drinking a lot of fluids, wearing the compression garment, all helps minimize the swelling, okay? The swelling usually you'll see a big difference in about a month, but your total result you're not going to see until about 3 months after surgery. In the operating room, the nurses will be putting on a black sports bra, a surgical sports bra on you. So the black sports bra looks like this, okay? It clips in the front, and it also adjusts over your shoulder for shoulder length, okay? You will already have this on when you arrive to the recovery room. Upon the arrival, we will be putting ice packs on you. Okay, so you will be expected to come back the next day for your first post-op visit. You do not remove your bra or shower or bathe until after you see the doctor tomorrow. You can wash your armpits and your privates, but we don't want you taking anything off, okay? When he exposes you, you will notice that you will have brown tape over the incisions. You are not to take that off, okay? That is there to help secure the incisions. When you shower, you can shower and wash with soap and water right over the brown tape, and then you pat dry, okay? And then you're wearing your bra. You're putting that on after your shower again, all right?
Okay. What kind of pain should I expect?
A lot of people with breast reductions and lifts, they describe the pain as a burning pain. A lot of patients have described it as that your breasts feel like they're on fire. We will give you pain medicine in the recovery room to help alleviate that, but it will not take it 100% away. The ice will help it, and medication will help it, but ultimately time is going to make it dissipate completely away. So by tonight, after your surgery, and it should be away, if not tonight, by tomorrow morning.
Okay.